Yep,
Ms.
Commissioner
Scott?
Bowers, feel free to call the meeting to order. And just a note of point of order on this side. For those that are viewing electronically, we are not able to see your guest.
Okay, they haven't shown up yet.
Okay,
Door is open, so they can come in.
got it.
Alrighty, I would like to call the Snoqualmie Valley Health Board of Commissions and CEO report to order. Ms. Scott, would you mind taking roll?
I sure can.
Thank you.
Temporary Chair Bowers,
Here,
Secretary Aaron,
Here.
Commissioner Haugley,
Present.
Commissioner Carter,
Here.
CEO Jensen,
I am present.
CNE Ralston,
Hello, I'm here.
CFO Ritter,
Here.
CSO Moore,
Good evening.
and General Counsel Hauser.
Present. Good evening.
Good evening, and we have guests on site and remote, it looks like. And you are ready to go.
with that, I would like to call for approval of the board meeting agenda.
So moved.
I'll second.
I second. Oh,
Thank you. At this time, we'll call for election to board positions.
Um,
Oh,
Point
we
of
gotta
order,
vote on the agenda first.
Got to
Oh,
vote, yeah.
You have to approve it.
commissioners, do you approve of the board meeting agenda?
Aye.
Aye.
Great. So for purposes of the secretary, that's 4 ayes and passes unanimously.
yes.
We'll move on to the election of board positions. Thank you, Commissioner Bowers, for your help with that. At this point, the once a year that Jennifer gets to conduct the meeting is now. And so she will take over and help conduct the first part of the elections for the board positions.
Perfect.
That is right. So the election of officers of Board of Commissioners as required at the, well, not first regular meeting, according with the bylaws. Current temporary Vice President Bowers is automatically nominated to the office of President. That nomination does not need a second. So I will now call for additional nominations.
I nominate Commissioner Haugley, Kevin Haugley, for president.
And I second that.
Are there any other nominations for anyone else on the board for the office of president? So we will now proceed. Well, we don't need a roll call, I assume. That's actually Council Hauser.
You'll need to, you'll need to call for a vote, Jen. There are 2 candidates technically, unless Commissioner Bowers wants to decline the nomination.
Mm-hmm.
I will respectfully decline the nomination at this time.
You
So
would
there
close the
are-
nominations then at this point, but you would take a vote, even though there is only one nominee, Madam Secretary.
That's correct. Thank you.
So we will vote by roll call since there is one nominee for president, Kevin Haugley. Commissioner Haugley, how do you vote?
Yes. Respectfully.
Commissioner Carter, how do you vote?
Yes.
Commissioner Herron?
Certainly, yes.
Thank you. Commissioner Bowers?
Yes.
Okay. So having received majority vote, Kevin Haugley is elected to president of the board for the remainder of 2026 and the year 2027. And now you get to do the next set of elections, Mr. President.
Jennifer, thank you and well done. And thank you,
Jennifer.
thank you, everybody. I will try to live up to your expectations. With that being said, I will go ahead and open the floor for nominations for Vice President.
I nominate Commissioner Jen Carter for vice president.
I would second that.
Thank you. I accept.
Any further nominations for the position of vice president? Hearing none, we'll do a vote. Jennifer, would you please do a roll call vote?
Sure can. Commissioner Howgley, how do you vote for vice president?
Yes.
Commissioner Carter, how do you vote?
Yes.
Commissioner Herron
Yes.
and
Definitely.
Commissioner Bowers?
Yes.
Okay,
Okay.
thank you, Jennifer.
Mhm.
Next, I'll open up the floor for nominations for secretary.
I nominate myself for secretary.
I second.
Any further nominations? Hearing none, go ahead, Jennifer, if you'd please take a roll call vote.
Commissioner Howgley,
Yes.
Commissioner Carter,
Yes.
Commissioner Herron,
Yes.
and Commissioner Bowers?
Yes.
Very good, thank you. Jennifer. Now we go into appointments for committee seats. I'm going to do something a little bit different this time, and I hope you all find it to be very productive. And that would be to, I'd like to solicit input from the three of you as to, rather than just assign you to a particular committee, would you please, I'm going to ask that you send me your desire, if you will, and maybe a couple of comments on why you'd like to have that position. And then if you could do that in the next, oh gosh, I'm thinking the next week, so that we can go ahead and review those, and I can ask any questions that I can follow up, and then I would assign those in the May meeting.
So, Chair, Mr. Chair, could you tell us what those committees are,
Oh,
please?
thank you very much.
Yeah,
At this
Emma,
ti-
we currently have two committees that can be assigned by the chair. The first is the Quality Committee, and the second is the Finance Committee.
Okay, thank you.
Guess a
Thank-
question, statutorily, do we need a commissioner on the finance committee for the warrants or anything like that? Just to show up for the month, or can we not have commissioner representation? for this
So
one?
if we just left committees as they are right now for this month, which is totally fine, Kevin would serve in that spot on the Finance Committee, and then Emma and Mark would serve on the Quality Committee for the next month.
Okay, that's cool. I thought we were like dissolved.
We'll just leave you as you are, and then you can negotiate with Kevin, and we'll go from there.
Roger that. Okay, thank you.
And thank you, everybody. I'm hoping it's a really positive, since I've been involved in the district and the board, I don't think I've ever had the opportunity to solicit input as to, golly, I'd really would like to be on that committee. And this is why, and so thank you all. With that, I'll go into public comment. And that being said, please limit your comments to 3 minutes, state your name and the community that you reside in. Are there any public comments?
And for an order of just point of order,
Thank
if you
you.
would like to speak tonight, please raise your hand, your virtual hand, and Jennifer Scott will call on you in the order that the hands are raised.
Thank you, Renee.
First hand is Steve Bradshaw.
Oh, Steve,
Hi, thank you for
Welcome.
letting me share.
absolutely.
Glad to be here. My name is Steve Bradshaw. I'm the manager of the imaging department here at SBH, and I'm really grateful to be part of this team and the work we're doing here in healthcare and in the Valley. And I also want to say how excited I am about the vision and direction of this organization. There's a real sense of momentum and excitement right now, and I appreciate being part of it and be able to contribute alongside all of you and the leadership team. I know you guys all have an important responsibility ahead as we consider appointment of the new member of the board. This decision will really help shape the future of healthcare in the Valley and will impact and be felt across our organization and the community that we serve. And I just really want to encourage you to consider individuals who are most importantly collaborative and bring a genuine curiosity and have a willingness to learn. Healthcare really requires thoughtful leaders who are ready to engage and ask good questions and truly partner in support of our shared mission here. And so I really appreciate the care you guys bring, and thank you for serving as part of the board. And I just really look forward to working alongside whoever you choose for that. So thank you for letting me share.
Steve, thank you so much for those words. I know it's going to be, it is being recorded. So you said that so well. Thank you very much.
You're
Any further public comment? Any second time, any further public comment? And lastly, anyone from the public care to make a comment? Hearing none. Next on the agenda is our consent agenda. And I'd like to entertain a motion to approve the consent agenda as it's presented.
I make a motion to approve the consent agenda.
Thank you, Commissioner Herron. Can I have a second?
Second.
Thank you, Commissioner Bowers.
Yes, sir.
Motion's been made and seconded to approve the consent agenda. All those in favor of the motion on the floor, please signify by saying yes.
Aye.
Aye. Aye. I believe that was everybody. Thank you kindly. Opposed, no, and abstain, no. Okay, very good. Thank you. Now I'm going on to our fantastic time of the meeting, the patient story. Renee?
Yeah, Trish is going to share the patient story tonight, but I just want to say each month it's getting harder and harder to choose because we have so many. So I wouldn't want Trish's job, but she's going to bring a good one for you tonight.
Oh, Renee, you must have known I had a few for tonight then. It is becoming harder and harder. Good evening, everybody. Yes, the favorite time of the board meeting. So a few short comments from some patients who elicited feedback to us or gave feedback to us. We just love the fact that the hospital is so close to home and now expanding, which is very exciting to meet the medical needs of the Valley and beyond. It's great how many new providers will be hired and the new job opportunities that are being created. I like the idea of the cafe and restaurant as well. Another one, can't say enough good things about Renee and Craig at the front desk. After taking a wrong turn in the nearby foothills, I hiked until 10 p.m. and ended up shivering all night in just a sweater. Fortunately, I came out the next day near the I-90 Highway 18 interchange and made it to the hospital. Craig was able to get me a ride with Yellow Cab back to my faraway car after trying other companies first with no success. And Renee provided a much needed hot soup for me so I wouldn't pass out before getting home. It was such a pleasant environment there, waiting for the longer than anticipated cab. Thanks to them, I was up at 2:15 a.m. the next day for my job with USPS. That's a really cool one. I have been inpatient as well as a patient in the ER. This is my third story, sorry. This is the best hospital I've ever been to. The level of care, compassion, and treatment is outstanding. As an inpatient, the level of care is beyond any I have experienced elsewhere. The staff is the best, they truly care, and the food is great as well. I highly recommend this facility. It's just some really nice call outs. And you all know about our ROCs and our ROC program here. And so I've decided, along with the patient story, I'm going to read a ROC story tonight, which is very heartwarming. So this was submitted by one of our staff about one of our nurses. I want to take a moment to recognize the truly outstanding compassion and initiative demonstrated by one of our ED nurses, Christine Postiglione. While caring for a patient in the ED who had not had access to basic hygiene for quite some time, she went far beyond providing excellent medical care. She took the extra step to ensure the patient was able to shower, restoring not just comfort, but dignity during a vulnerable moment. Her advocacy did not stop there. Noticing the patient's worn out shoes, to say the least, she proactively reached out to a local business to ask if they might have any gently used or returned footwear available. Thanks to her efforts, the patient received a new pair of shoes, and incredibly, the business was so moved that they donated additional pairs for us to provide to future patients in need. This is a powerful example of what patient-centered care truly looks like.
Her empathy, resourcefulness, and dedication reflect the very best of our team and our mission. We are incredibly fortunate to have her on our SVH team, and this kind of work does not go unnoticed. It makes a lasting difference. Thank you for being you, Christine. So thank you for letting me share that. Really, really just a beautiful representation of all the things that happened here in just a month since we last spoke.
Thank you, Trish. It's always a
Thank you,
great way to
Trish.
start our board meeting.
Thank you. That's great.
Okay, now we move on to, thank you, Trish. Now on to commissioner business. And Patrick, I believe you have Baker, Tilly?
I think we are going to pause on that one till next month. We have additional information, and so didn't get a chance to pull it off the agenda, but we will save you some time tonight, and we will review that next month with the board.
Okay, thank you, Renee. Director, is it Rudberg?
Yeah, it's Rudberg.
Yes.
Thanks.
Yeah, welcome.
Thank you. So I'm back this month to finish up with a few slides that I wasn't able to get to last time. There was a lot of great things to talk about on the quality plan. And so this is a couple of slides that you might have seen before, but I'm going to tell you a little bit about our survey on patient safety that the quality program put into place at the end of December. We surveyed our staff, and I wanted to give you a little bit of background on what the survey on patient safety is. It's a survey from the Agency for Healthcare Research and Quality, which is a federal governmental agency that helps provide things to improve healthcare for all of the residents of the country. And one of the things that they put out is a survey on patient safety culture. And so that's measuring the culture of patient safety in an organization. And a good definition of what patient safety culture is the shared way that we think, act, and make decisions to keep our patients safe. So basically, we're trying to find out how positive is our culture. And a culture that is positive means that, here's some examples of things with a positive culture. The staff prioritize safety over competing pressures. That staff feels safe speaking up. So if they see something that's not safe or that they don't think is right, that they can speak up and make that known to people. That leaders prioritize safety over productivity. That mistakes are seen as opportunities to improve and not opportunities to blame people. And that teams work together to reduce risk. And an organization that has a positive safety culture really makes transparency a priority, and mistakes are openly discussed. So by assessing the safety culture, we're able to detect some things that might have gone unnoticed before they progress into a safety incident. And things like poor communication or unsafe processes are called out before they occur. And so there are a number of different surveys that the Agency for Healthcare Research and Quality put out, but there are two specifically that we used. One represents the hospital, and the other one is for our clinics. They asked some similar, but some questions are different. So Jennifer, if you could go to the next slide, we could show you a little bit of the results. The questions go into a lot of detail, but I just wanted to pull out some highlights here as to who responded to the survey and how we did. So our response rate was 44%, which, we would have liked it to be a little bit better, but because this is the first time we've delivered this survey, that's a pretty good result. The national benchmark is about 52%. So those are for most hospitals that have done the survey before. And the things that I'm comparing this to, the benchmark data is hundreds of hospitals throughout the country that have filled out this survey before, and the results are tallied. So this is a really large sample size for the comparison groups. The most responses came from nurses. So 22% of our responses were from nurses, which I think goes to show how many different types of people responded to this survey. We had environmental services and the kitchen and providers and physicians respond. So we got a really good cross section of staff. Excuse me. The most respondents that the biggest category of tenure is between 1 to 5 years, which is about 55% of our employees that responded were in that category, and that's pretty typical for most organizations. So the responses were actually pretty incredible. And I'm coming in new to this organization. I've been here about 7 months now. So I was very interested to see the results of the survey, to see how people felt about the organization. And so this first question is, what percentage of staff have entered one or more safety zones, which is incident reporting? And we know in healthcare, due to some research that's been done, that only about 10 to 15% of incidents or near misses actually get reported in healthcare. And so the fact that 55% of our staff have submitted at least one of these is really strong. The benchmark data for hospitals that have been doing this for a long time is about 44%. So we have a higher percentage of staff who are engaged with that. And then the next one is really the overall rating on patient safety, which is kind of the overarching category for how well people feel that they're represented from a safety perspective in the organization. And it was a rating scale from 1 to 5, and the top 2 are very good or excellent categories. And 93% of our staff said that our overall patient safety in the organization is very good or excellent. And that compares to a benchmark of 68%. So really outstanding results there. There are a lot of different questions. There were close to 30 questions that staff answered, and they were kind of put into different categories, which are listed. Some of them are listed here: staffing and work pace, response to error, and things like that. But those questions are rolled up into a composite score for both the hospital and the clinics. Our hospital came in the top 1% of comparison data, so really the best of the best. And our clinics also did very well and ended up in the top 25% of all hospitals and all clinics surveyed. And in looking at some of these categories where we performed really well, staffing and work pace, we were in the top 1%. Our response to error, our teamwork, also in the top 1%. And you could see there that 98.9% of our staff gave us a positive rating on teamwork in the organization. So that's how you get to the top 1%, because there's a lot of great teamwork in healthcare. Handoffs and information exchange, still in the top 10%, communication openness as well. So after seeing these excellent results, kind of wonder, well, what did we learn from this? For one, that we're doing great. And there were some questions that we still performed well on, but not as well as these top 1% numbers. And so an example of that is staff want to hear more about what's been done when they report one of these safety zones. How was it addressed? What happened in the end with their report? And so providing that communication back and that feedback loop is something that we can do better. We have managers and staff working on these incidents as they come up to help fix the issues. But now we're going to work harder to communicate back to the people who enter them so that they can see that the loop's closed, and it just encourages them to continue to report more. So this is just.
And I'm gonna interrupt you for a second and just take a pause, because I want the commissioners to really digest this information that you've just provided. We shared this with the quarterly quality committee, and so Commissioner Herron and Commissioner Carter saw this previously, but I have never in my entire career seen the culture of safety survey this strong and this positive across an organization. This is really impressive. Yeah, thank you for the applause, Trish.
Congratulations.
Top 1% is just incredible. And it's a testament to the hard work of our leadership team and how they lead their individual teams and their departments. And it really reflects just a great culture. And I'm really impressed with this. And you may also hear this survey referred to as the culture of safety survey. That's kind of the standard nomenclature across the industry if you want to relate it to something else. And love to take some questions before we turn Ken loose again.
I just want to make a comment. I like the fact that we really also focus on the comparables, the comparison, and it seems like we're we're all going over that percentage in terms of, was the first one I heard was 68 versus 44%. So I think that we are exceeding, I think we're exceeding the percentage that's overall national or is is that national, taking national, local, or just the state of Washington? I'm not sure where
Yeah,
the
this is
comparables are coming from.
yeah, this is national
Federal,
data.
national
Uh,
data. Okay.
And you
So-
make a really good point because some of these questions just naturally are lower, like staffing and work pace. You'd say, well, it's only 87.5, and how's that the top 1%? But that's because staffing and work pace is a much lower scoring question than, say, teamwork is across the nation. So having that benchmark data, you're right, that's really valuable to helping us know where we stand.
Yeah. Thank you. That's great. Excellent.
Yeah, Ken, I
Yes.
would jump in and say that I really keyed in on when you said, these numbers are really spectacular, or maybe you didn't say that, you were humble, but they really are on a national level. But then you circled back around and said, what can we do? And I think you came around to call back to the clients, or not clients, excuse me, the patients that reported, and really try to circle that back. And obviously that's going to encourage them to continue to offer their support and their
And
comments.
Commissioner Hugley, one point of clarification, this is a staff survey. This is what your staff or frontline staff are telling you about the culture within the organization. And so we use the safety zone product, which is where when we see something wrong or we see something that can be improved, that is how we enter like, hey, there's something that could be better. And what our staff are saying in that one kind of lower response, which even lower is not lower compared to these scores, but it's an area we can work on. But they're saying, hey, we tell you there's something that could be better, and we don't feel like we always get the loop closed and we don't know what happens, even though we know things are changing.
Thank you for that. Yeah, and I would say even more remarkable that you're circling around and closing that loop. And so congratulations, and I'm excited about the next report that we hear.
Great. Any other questions?
These numbers are very exciting. I think any hospital in the state of Washington would be happy with those numbers. The number that I especially like is that staff reported 55%. 55% of staff reported a near miss or something that could have been improved on. I think that's a pretty high number too, isn't it?
Yes, that's more than 10% higher than the national average.
I like it.
Congratulations.
And that's the only way we find out what's going on in the organization. If the staff who are there at the front line, who see the potential harms that could happen, are reporting it to us, that's how we can fix things. And anything we can do to increase the number of reports, which sometimes, could be considered that our rate of events is going up, but that's what we like to see because we're just getting more reported, and that tells us what we need to fix.
Outstanding. Thank you.
Great, thank you.
You betcha. Any other questions from Ken by anybody? No? Okay.
Just a
Thank you.
quick comment, Ken, that appreciate you. This was one of the things that you had on the top of your list as you started here 6 months ago now?
Just over 7.
Just over 7. Okay. And just really appreciate you and your team to kind of put the work into doing this. Really cool to see, and thanks for reporting out.
Yeah, of course.
And Ken, just for the commissioner's knowledge, do you plan to do this survey every year or every other year?
I would like to do it every year just to see how we're trending over time, the areas we're getting better, the areas that we could improve on.
Great, thank you. Ken has been a wonderful addition to our team. We are so thankful to have him.
Is there a national competition to see who gets the highest score for the culture of maybe
I think it's just bragging rights, Emma.
Bragging rights? Okay.
Okay. All right.
Okay.
Thank you very much, Ken.
Yep. Thank you. Okay. Going on to our next item on the agenda here is nominations for candidates of the board vacancy. At this point, I'll go ahead and open the floor. Emma, I think you were going to take the lead on this as far as nominations.
Just to clarify, did we say 3 candidates out of the 5 or just 2?
We had
I think we
discussed.
settled on 3.
We settled
Yep.
on 3. So I'd like to nominate 3 candidates, and they're not in order. The first candidate would be Jonathan Pernstein, Robert Angrisano, and Mr. Scott, Dennis Scott. Thank
Denny
you.
Scott. Okay,
Those are the
and
three.
so, thank you, Commissioner Herron. Renee, would you go ahead and please share, for the benefit of everybody, kind of the next step in this process, as far as filling that appointment?
Yeah,
Just one
actually,
second, if I might. You've got a nomination, but you don't have a second. So before you start
you.
further discussion, you'd want to second and then open discussion, Mr. Chairman.
Very good. Thank you,
Second.
Skip. Thank you, Mark. Commissioner Bowers, seconded, and all those in favor of the slate of nominees as presented by Commissioner Herron, please signify by saying aye.
and unless
Aye.
there's any discussion,
Aye.
you're welcome to do discussion at this time too.
Okay.
Let's go ahead and we'll do the vote first, and then we'll do discussion.
Well,
So,
Mr. Chairman, you'd want to discuss and give the opportunity for any individuals to consider the motion. If you did the motion and voted, then the discussion would not have any value.
thank you very much, Mr. Hauser.
Sorry.
Any further discussion on the slate of nominees?
For clarification, the names are not in any order. I just want to be clear. Thank you.
I also want to thank the other members of the community that expressed interest. There are lots of places for you to get involved in the hospital. Thank you so much for putting your names out there and putting yourselves out there.
Commissioner Bowers?
I'm excited about the candidates. I think whichever way we go, we're going to do well.
Thank you. I would echo all the comments. What was particularly exciting this time around is the quality of all the candidates that we've had, and it's really been challenging and will continue to be challenging to come to a final conclusion here. But it's just an honor to be a part of this process with all three of you, and thank you for all the time that you put into it. So with that, okay, that was our discussion. Now we'll go ahead and take a vote. All those in favor of the slate of nominees, please signify by saying aye.
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 Aye. Opposed? And abstaining. Hearing none and none, motion carries with the slate as presented. Renee, would you please go ahead and elaborate on our process?
Yeah, so thank you, everyone. So we at the district will publish those three names that you have determined to be who you are considering for office for the next 15 days at minimum. And we have a 90-day window to appoint the candidate. We anticipate that we will be able to make a selection of that candidate by our next regular board meeting. And a discussion topic on our agenda here would be for the commissioners. I do know that you have some interest in interviewing these candidates. And if I know Commissioner Carter potentially had a solution for how we could achieve this, if you wouldn't mind maybe some discussion on that, that'd be great.
Sure, I just had a brainstorm that what we did previously today worked pretty well. So what do folks think about us having the interviews prior to our regularly scheduled May meeting? So it would be about a month from now. It would be at, maybe 4 p.m. We can, we'll let Kevin figure that out. Interviews from 4 to 5, and then discussion from 5 to 5:30. And then we have a regular board meeting following that. Does that make sense for folks? Do you like that approach? I think also having it as virtual rather than in person, or perhaps we check in with folks and see if they prefer, now that we know who the three are, if they're available to do in person. But making virtual also a choice so that everybody that wants access can have access. Are the interviews, is that part of open public meeting?
It is, yep.
It would be, okay.
Yeah, so with that proposal, what we could do is a 4 o'clock start time. I do think having virtual is definitely makes access more equitable for everybody. So we could do it at 4 o'clock. It would be a regular session, a special meeting, but an open session. And you would prepare questions for your candidates. I've seen both ways where you can ask other candidates to not attend, but they have the right to attend. And so it's a little bit awkward because it's a public, it's publicly, everybody can do that. But you can ask candidates if they wouldn't mind we can do a breakout room or something. But again, they're still there. They can be there for their candidates' answers to their questions. So we could do that at 4 o'clock, and we could conclude around 5:30. Give you guys about 15 minutes to kind of debate if you feel like that's enough. And then you could conclude your executive session and then open your regular board meeting after that at 6 o'clock, if that worked for everybody, if you felt like that was enough time.
That seems reasonable to me. I think that it might not go past 5 o'clock, but that's yet to be seen. So,
yeah, like 15 minutes per person or something like that. And then,
exactly.
we don't need to spend everyone's time on that part.
If that general idea sounds good, my team can work on putting something together and getting it structured and communicating with the candidates for you.
Thank you.
Commissioner Herron, is that?
Yeah, that sounds
Makes sense.
doable. That would be
Yeah.
great. Yeah.
Yeah.
15
And
minutes.
Commissioner Bowers?
We can talk about it.
That works fine. My only concern is I usually work until 4, but I can always block out some time if I know well in advance.
Okay.
That
But the
seems-
days that you work, would you let us know so we know exactly how many days and what time? So that
I think what Commissioner Carter proposed was a month from now, so it would be the same day just before our regular meeting. So
okay,
it gives
yeah,
quite a bit of notice there.
there you go. Thank
Commissioner
you.
Bowers, would that be acceptable for that date for you?
Yes, I appreciate the accommodation.
Okay, and since if it's virtual, it will make it easier to get to wherever you need to be and miss as little time as possible with your patients.
Thank you.
Okay. And we'll move forward on that basis. And thank you, everybody, for coming together with a plan that works on that. So thank you very much. I'm really excited about that step. Moving on to our CEO report. Renee, you have the floor.
All right. Obviously it was included in your packet. A few things I'd like to tell you a little bit more about, but as always, I'm open to questions about anything. Our capital campaign and Steve Wright and our foundation are doing a fabulous job. We have over $200,000 in donations for our capital campaign at this point, and just some great work. And it's the support from our community and the individuals is humbling, and we really, really appreciate that support and the work that the capital campaign committee is doing for us. We've been doing the Hub Roadshow. Thank you to those of you that have been in the different venues where we've been presenting the Hub Roadshow. I'm exhausted. My team thinks it's fun to get out there in the community, and we're doing early mornings and late nights and luncheons and you name it, we're doing it. But it's really great. Even though it's exhausting, just that interaction with the community and getting to share the vision and the story of the Hub has been fabulous. We've had nothing but a wonderful response to it. So I appreciate Kelly Bender, who is our outreach manager. She joins me and chaperones me for most of these. And her job is to take notes and do follow-ups, and she just does a fabulous job. She also recruits new patients while we're there as well. So great job to Kelly Bender and our outreach team. Let's see what else is in here. So under our health system of choice, I wanted to do a shout out to our lab team, and you may have seen this in the report, but we broke a record, 50 patient visits more than any other month in the history of the organization. And Kelly Miller, our lab manager, she shared with us that this has doubled the volume since she started. And she also told me that she came here and she was going to work just for maybe a year or two, and then she thought about retirement, but she loves her job so much that she stayed. And she's just having a fabulous time and doing a great job with that team. They also get some extremely high patient satisfaction scores. So despite the fact that they're getting busier and seeing more patients, they continue to really set a good example for the rest of the organization. So shout out to that lab team. They're amazing. Our MRI project is continuing on a schedule, And there will be a parking impact next week. So 2 days next week, we will be bringing in another giant crane, somewhat similar but different to the one that's working on the hub in the back of the building. And we will be putting, I guess, for lack of a better term, the box that the MRI will go in will be getting installed. And so that's a really big project. We have to clear out the entire parking lot in the back for safety reasons and access. And so we'll be asking our staff to park on the street, and the construction crew is clearing out as much as parking as they can on the hub site so that all the construction workers can park up there and free up space for staff on the street on 99th. So just the day in the life of a SVH employee right now, just trying to figure out a place to park so our patients have places to park as well. Under people, you may have missed it. I heard that that some people had missed this, but Director Danny Scott was our facilities director. He has left our organization. He took a wonderful opportunity for growth in his career. He's well supported by our team in this. We were very excited for him. And he gave us the biggest gift in the entire world before he left. He actually recruited his own replacement. And we will be welcoming Neil Bergar. Well, I'll have to figure out his last name. Sorry about that, Neil, if you're listening. So Neil starts with us just right after the champagne brunch. He's going to attend the brunch on next Friday with us, and then his first day will be next Monday. He comes to us from Overlake, has a ton of experience. He's got experience with building construction and new facilities. He worked side by side with the current GLY team at Overlake on their large expansion. He has experience with operating rooms and other critical facilities like we have coming in the hub. And so Neil will be a great addition to our team. We're very excited about him coming. He is a resident of our district. He lives in Carnation. And so every time we hire a new staff member that it lives within our district, it just makes my heart full. And so I'm happy to welcome him to our team, and very grateful to Danny Scott for helping to find such a fine candidate to replace him. Although I guess you really can't replace Danny, but we'll take it. So thank you very much for that. Provider engagement. We do something very unique here at SVH, and we not only do we do strategic planning with our board and our leadership team, but we also do once a year strategic planning with our providers. We work with our operations team to close down our clinics and not have any patient visits. And we take our providers off-site for about 24 hours for an overnight, what I would say is kind of like a camping trip, but not quite camping. Depends on what your definition of camping is. More kind of like a dorm room situation, but out at Rainbow Lodge, a beautiful facility out in nature. It's very quiet, very serene. We work on team building. We do some professional education, and we really dig into that strategic plan with our providers. Tammy does the lion's share of the help and support for that. She and I co-lead that together. Thank you to Ashley and Narrow for all of the support to make that happen. But it's one of those things that you cannot replicate just about anywhere. And the connections and the bonds that we come away from that with those providers is truly amazing. It's fun to see them walk in the same day and say, "Oh, hi, my name is, it's nice to meet you," realizing that they're new specialists or they work at different clinics and they've actually never met in person before. Or urgent care providers that are at a site that don't necessarily get to main campus all the time. And then they go away and they have new colleagues and new friends. And so it is really a tremendous experience. I just wanted to shout out to Tammy for all of her support for making that happen, and thank all of our providers for giving up time away from their families in the evening to be able to attend that. Also, under our people category, an update on our CMO search. We continue to be very diligent in our CMO search. We've had a large number of candidates. As you know, we did one round of in-person interviews and we chose the candidate, which was Keep Looking. So this is our second go around at that. And we are through the initial part, the screening part, the on-site interview with the executive team. We've selected 2 candidates to bring back on site that will be meeting with our leadership team and our medical staff. So we are hoping to get those completed in the month of May. And I hope that we will have a new CMO candidate to present to you hopefully by the end of the year. So good. We have really good diversity there of choices. So I'm excited. I'm not going to give you too much more information because at this point, these candidates still need to be anonymous in respect to their current employment and their current organizations. Oh, let's see, hub update. We had a fun day today out on site. We had what we call a box walk. And this is, we focused on the lab and urgent care areas most specifically. But we take our drawings, we take our architects, we take the construction team, and we find the electricians, and we walk around and make sure that every single electrical box and data box is in the correct location, that we haven't missed one. And when you see it in person, sometimes you're like, oh gosh, I didn't realize it was going to be this high or that low, or there maybe should have been two there instead of one. So we did that box walk today. And it must be highlight Kelly Miller today. She is amazing. She should be a construction quality control person because she does nothing gets by her. She has attention to detail, and she made sure that she was keeping those contractors honest out there today. So great work to the team. And it's incredible to get to engage them at this level of the construction project in those spaces. And it really gives them a large amount of ownership, but it also makes sure that we do it right and we don't have to do any rework later when the sheetrock starts to go up. So great job to Will and Lauren and everyone else who joined us out there today. We are really starting to dial in. We have a coordination meeting coming up with the city of Snoqualmie. They have just been great partners through this portion of the project. They're working really hard. They don't have as much bandwidth on their team as they probably need, and they're working on that. But the staff that are there are just putting it all out there for us to get things done and get things approved, and we'll be having this coordination meeting with them to make sure that we're timing between construction getting wrapped up and occupancy into the building, as well as staging the equipment and some of the larger analyzers and things that need to come in. And so we'll work on kind of the timeline around that temporary certificate of occupancy. So some of these things we need a lot of months of lead time for. And so just because we acquire the equipment doesn't mean that we can actually install it right away. We have to wait for a certificate of occupancy, or maybe if the city is willing, we can get in a little bit early and get things going sooner. But there are some long lead times on other things like approvals from Department of Health, and specifically in the areas of pharmacy, surgery, and the restaurant. And so we have to be open and have staff in there and training and installing equipment and operating for sometimes 30 to 60 days before we can get those final approvals to be fully open to the public. So you're going to see that work happening towards the end of the year. And then we should be we're still debating whether or not we're going to open some areas a little sooner than others, but we should be fully open to the public in the first part of March. And that will include all of our inspections and all of our certifications. So even though we're basically complete with the building, there's still a lot of things that have to happen before we actually activate and go live. Any other questions about the hub? I want to make sure that I pause there and see if there's anything else you want to know more about. We are doing a very detailed hub budget presentation that we do to the finance committee, and we're showing those expenditures and the cash flows and the spend down in a much more detail through the finance committee. And we currently are on budget and on time.
That's a great update, Renee. Thank you.
Yes.
Remind me, please, what we're going to do with traffic on the parkway. Were we going to get a traffic circle or a stoplight? What's going on with that?
We are installing a very bougie, if you look at the price tag, stoplight. So there will be a controlled intersection at the intersection of 99th and the Parkway. So our current entrance there will be getting a traffic stoplight, and yeah. It'll be great. We need it. It's a very, very dangerous intersection, and that will be completed. We actually are starting there. You'll see some trucks drilling some holes out there right now. They're doing what they call potholing on each of those four corners. So we're doing that now, and we are about to order the giant traffic light poles. Those take 6 months to get here. So once we order them and take about 6 months lead, we expect kind of October, November timeframe for that stoplight work to really be fully underway.
Are we absorbing the traffic light, or is this a collaborative partnership with the WSDOT, the city of Snoqualmie, and our hospital in King County? Is this a four-way partnership in terms of absorbing all the expenses due to that fact that we have to have that drilled and constructed according to
Yeah,
safety?
great question, Emma. That's a super question. So it's a very complicated intersection that has part of our property, part of the city of Snoqualmie, part of King County, and WashDOT. So all four of us are having to collaborate together. And if you think about the politics involved in those municipalities, like all of us being municipalities, pretty much, that is quite a lot of coordination. We are solely responsible for the cost of that. However, the city of Snoqualmie, they assess for all new developments, not just for us, they assess what they call a traffic impact fee. And that traffic impact fee, they are allowing us to credit it back towards the cost of the construction of that traffic light. So essentially, it will offset some of those expenses, but it is a condition of occupancy for the hub. So we will be required to complete that project with our own budget. I did submit for a state appropriations this past cycle for that. And we were put forth thanks to Senator Hunt, part of the Senate budget and transportation. And they were fairly positive that that was going to get funded. But unfortunately, just before committee recessed, they did not fund any projects that hadn't been previously funded. So because ours was a brand new ask and it was off cycle, it did not get funded. So we were working on just kind of cash flow and just different parts of our budget and seeing what we can contribute to the traffic light and maybe delay purchasing on some equipment we may not need right during that time. And then we're going to go back and work with our representatives to see if we might be able to find other areas of the budget that they can support to offset that cost.
Many of them had discretionary expenses that they can donate and earmark. One of my understanding prior to all this is that the city of Snoqualmie and King County were working together or trying to get the State Department Transportation to allocate all the dollars, or maybe get that Snoqualmie Parkway part of the I-5 or the highway.
WashDOT.
Right,
Yeah.
right, the WashDOT.
Yeah,
So I don't
that's
know whether
definitely-
that's my understanding that they did say yes. So now I guess it's a different cycle, different story.
Yeah, there's a lot of nuances involved in who pays for these particular improvements. And the year prior, we had talked with our state legislators about supporting this project again, but all the funds have been allocated to that Highway 18 infrastructure and that diverging diamond. And so there's so many projects and so many things that need to get done that there just isn't enough funding to go around. But we did anticipate this as part of our hub budget. And so overall, we think we will be able to manage it and still be able to deliver.
Okay, and we can revisit it with the legislators, the department.
They're
the
not
head of
getting off that easy, I
transportation
promise.
committee. All right. Thank
Yes,
you.
and also to remember that our legislators, both the 12th and 5th last year, gave us the $3 million for the pre-construction costs of the groundwork. So that $3 million helping get the shovel in the ground early has really relieved some of the tension that's allowing us to be able to work on this traffic light without a lot of anxiety. So they've been really good partners, and I predict that they'll help us again next year too.
Yeah.
Great question.
Also be able to help the city of Carnation with their traffic situation too, weren't you?
Yeah, so we were able to help with an ask. The city of Carnation has been asking multiple years for a roundabout, kind of where the Rendlinger farm is there. They were actually the only project that got funded out of that budget that hadn't previously been funded, but there was so much support across all of our area and our valley for that project that it was just, and also just the safety of that. So yes, thank you, Commissioner Bowers. It is always fun when you're visiting your legislators to be able to support another request in your community.
Now, so if I understand earlier, you mentioned that the grand opening would be March of 2027. So we are not launching it this September as some people are expecting that we were. How do we offset that knowledge that, well, based on what you already said, the many needs that we have to first meet, and all
Yeah,
the impacts.
another great question, Emma. So when we said that we're getting completed at the end of fall, that is true. The construction is wrapping up at the end of fall, but then we have to bring in all the equipment and we have to get the permits and we have to get the approvals and the licenses. And so that's that kind of lag time between there. I've been pushing really hard to make it go faster, but at some point it can only go so fast and we have to do
Oh,
it right. So
yes.
again, we were considering potentially opening some of the areas early to start to generate the revenue and see the patients. But we need more discussions with the city and more discussions with my team to see if we can actually do that, or if it's just going to be too much and it's better just to wait a couple of months. I know Mr. Ritter, he wants my ops team to deliver it as soon as we can because we need to utilize that space. But I think, yeah, so right now it's going to have to be a flexible window on when we actually go live, but the construction itself is going to be almost completely wrapped up by the end of the year.
It's better to do it right than to be sorry later.
We agree with that. Yeah, and we also don't want to have our community not to have the best experience possible.
Yeah.
And so we want to make sure that we can deliver our brand and our customer service and just what people are expecting from us. So we don't want to rush it with that in mind either.
Thank you.
Great questions.
I just
Any
wanted
other
to
things you want to know more about? I do want to remind you that next Friday is our foundation fundraiser, our champagne brunch. Thank you to Commissioner Carter for helping to MC that event with us. And the funds this year, we are raising money to purchase a Da Vinci, which is a surgical robot. So it's really high-tech equipment that allows us to do much less invasive surgeries. And you're seeing the best practices, and Commissioner Bowers, you probably talk all about this, but it's really becoming the standard of care and best practice in urology, gynecology, and even some of your general surgery procedures as well. It's basically an upgrade from a laparoscopic surgery. And so it will help us recruit some freshly trained surgeons and also be able to deliver a really great standard of care here. And so a Da Vinci was not in our original equipment budget at all. But, things move quickly, and over the last couple of years, we've realized that this is going to be a very important piece of our surgical program. So we're excited that the foundation is helping to raise funds for that. And we invite you all to join us next Friday for our champagne brunch.
Renee, thank you very much. Kudos to the entire executive team. I still look forward to your monthly reports and also the weekly communications that you push out. I always enjoy those. And then to everybody that supports the executive team that we see before us at this moment, just again, continued effort on a day-to-day basis. And I'd love to hear the reports about walking through the hub and the sense of where does that box go? Where does that light switch go? Is it too high? Is it too low? Do we need more? And I just thoroughly enjoy that. So thank you so much, and congratulations to all of you.
It's coming along. It's just a very, very stressful but exciting process. It's great. So if there aren't any other questions for my CEO report or anything else you want to know more about, I'm happy to move on to the dashboard.
Please do.
Okay. Foundational elements. I can't remember if we alluded to this at our last meeting or if we actually made a final announcement, but we have signed an ENT physician. So that will be number 2. And so thank you, Dr. Moore, Tammy, for all of your efforts. Adding an ENT was top of our list, and we're super excited about adding that to our group. And I believe he will be starting in November. Pausing there. Tammy's going to give you some stats later, and I'm sure she'll confirm that for us. Under the community health, we continue, our outpatient visits continue to grow, and Tammy will give you some more detail when you see the dashboards and the finance report, but our teams are doing a great job. There aren't any areas that I'm very concerned about. Any areas that aren't looking like you would expect is because they're just maybe under budget, but most areas are performing far above what they did last year. So that's a very positive sign. Financial stewardship, this box looks a little bit different this month. We added a purple line, which is the budget and that is, it's weird to see a negative budget be a goal, but we knew we were making an investment in the hub this year. And so we do anticipate having a negative budget. And so you'll see our line, hopefully it won't get too close to that purple line. Hopefully it'll stay as close to that black line as possible. But the purple line is the floor. We don't want to go below that. Health system of choice, we continue to have great patient satisfaction scores. I think that is just tremendous. I asked the team the other day, I said, are you sure? And I was Googling and looking at some other things, and they're like, no, these are the patients that actually come here and use us and turn in their surveys are very satisfied with their care here. We also have Ron Bennett, who scrubs every single survey comment. And if there is anything that is not a positive comment, he follows up and digs into that to make sure that we can either do better next time or change something that will give the next person a better experience. And then I'm really excited to see that turnover rate continue to stay in the low 20s. I think I've been a little bit nervous about this one as we bring on a lot more staff and we grow tremendously over the next year. And I really applaud our team and our managers and leadership team for the retention of the great staff that they're hiring. So I'm really happy with the first quarter of our strategic plan dashboard for the commissioners. Any questions from this? Okay, we are on track and doing well here.
Okay. Let's move on to Mr. Ritter for the finance. You have the floor, sir.
Thank you, Commissioner Havley. The pleasure to tell the financial story. So taking a look at where we are year to date in on the income statement here, which is of course our revenues and our expenses. The actual where we are in gross patient service revenue, you can see we're actually above budget. So we've had strong gross revenues in the first quarter. Which has been, as you can see, good swing bed revenue. Our outpatient revenue is slightly under, but if you recall, that's most of it we will pick up at the end of the year as these providers ramp up their service. But we do spread out that estimate and that revenue, of course, across 12 full months. So by the end of the year, we hope to catch up on where we are on our outpatient and our inpatient revenue, actually. So ED is doing well with revenue, and clinics pretty much right on budget there for the gross revenue. So those are good news. Where we are a little bit under budget is on our contractuals. We're seeing, and we're not the only ones in healthcare that are seeing this, but our contractual allowances are much higher than we anticipated. This is a trend that we're seeing. We've dug into this a little bit here, and we're diving into Epic and making sure that these are actually true contractual allowances and not recoverable denials. So where it's getting categorized, some of those could be recoverable denials, so we could go back after those funds. Because we do have a contract management software that does check to make sure that any underpayments, if we have them, we're rebilling those. And so that software is working well, but our contractuals are a little bit bigger than that. So we think there's some denials in there that, like I said, could be recovered. So that is some work that the rev cycle team is doing. Lori's digging deep into that. Shauna and the finance team are working with that as well. Net patient service revenues there, therefore, because of those contractuals, is about $1 million under where we budgeted. Again, this is first quarter. There's time to recover that. If we continue to see the good outpatient revenues continue to grow, Dr. Moore will talk about the volumes a little bit later on, but they are trending in a positive direction there. So total operating revenue for the quarter was about 16.6 million. The other place where we're low, you can see there is our other revenue. And there are a couple of things that have not come in yet at the beginning of the year. One of them is the directed payments amounts. We expect to see those in late May or June, and that will be about $200,000 we'll see there. And then as well as some of our rebates for 340B are still outstanding. So the manufacturers are very slow. As you know, 340B legislation just passed from the state of Washington as well, and A couple of those manufacturers have actually sued. They've done this in every state where that 340B has, and they've lost in every state. So that will, we imagine that June 1st date will probably get delayed for when that 340B law goes into effect. But everybody has every confidence that it will eventually make it through the court system in the favor of the hospitals for that there. So that's where some of that delays on the 340B side are going. So obviously it's not reflecting that affects cash, that affects, being able to do that. But overall, we're encouraged by what's coming down the pipeline for the 340B and for the directed payments. Taking a look at operating expenses, of course, our largest one has to do with our salaries and wages, and that's a good thing because we are employing more people at the district. We are becoming one of the largest employers, if not the largest employers in the district by the time the hub is opened. Providing wages for those families, and we're excited that we're able to do that. You can see our contractual labor is well under budget, so we've done a good job of converting those agency staff to full-time staff, so that really offsets where that salaries and wages expense is over budget there. So when you do your budget, of course, you're building it upon trends, and our previous trends was less salary and more contracts. So it's actually great that this is reversing, because again, these are staff that are staying local and here and hiring, making good transitions from the agency staff there. Otherwise, most of the expenses are pretty well under control, and we have an operating net income of about $61,000 for the first quarter. So like we said, we're about $1 million short on the revenue. I explained those reasons why. So we're a little bit short there, but there's time to make that up. And the growing trend shows that we will. So overall, for taking a look at what we call below the line, our interest revenue, which is great. You can see that's much higher than budget. This is kind of the reverse effect, right? So we had a lot of cash. We're able to earn some interest on it. We're seeing those payments really up front early in the year. As we go later in the year, as the cash gets spent for the hub, we will see that interest rate go down and come more closer to budget what we have there. The nice thing about interest and cash, it's kind of a pretty good, easy thing to calculate, that that those amounts are. So those should come back down towards budget there. And then our tax revenues, we will see that tax revenue continue to be accrued and grow, and then in May we will see that balance hit our accounts, and then in June, of course, we will pay on our debt services for our LTGO and for our revenue bonds, and so it'll go back down again. Overall, though, we're pretty well on track, slightly ahead, well, below where we want to be, but that there are good things coming. We have some directed funds coming. We do have the RHTP funds that should be coming as well. That's the Rural Health Transformation Funds that came from the big, beautiful bill that will be coming. We have, as well as some distressed hospital funds that may be coming our way, as well as a couple of other grants. Of course, there's also the $300,000 that the foundation has raised so far for the capital campaign. So that will be eventually, when the building opens, coming back to our way too. So while the present picture isn't where I would like to have it, of course I would have that number flipped over, and we would be at $1.4 million in positive net position. We do know this is an investment, and we have a beautiful building out there. All that construction's happening. All those people are getting paid wages and things like that. So it is a very good story to be able to tell there. So that's kind of the financial picture.
Patrick, thank you so much. I know we talk a lot about this in the Finance Committee, but which I enjoy immensely. Just to underscore the benefit of this contractual labor number dropping down, and the real positive, as I shared in the Finance Committee meeting, was that these contractual individuals that are not only working and enjoying their work here, but so much that they continue on as a full-time employee. And that speaks volumes on so many levels. And of course, economically, it's a big win for the district. And not to mention the fact that we do have our construction money that's yielding an interest return, and that's contributing substantially as well as we work through the construction of the hub. And so, Patrick, again, congratulations on everything you and the whole finance team are working on, and appreciate you keeping us abreast of what is going on. So thank you.
Thank you. I
Yes,
appreciate that.
yeah.
Yeah, Finance Committee
I-
is lots of fun. So I'm glad I get to be part of it.
Yeah, Emma?
I'm glad you mentioned about the contract labor expense. I think, isn't this a new line item? Because my understanding, so I want to know,
No.
my second question is the professional fees expense.
Mhm.
What is included in that? I
Yeah.
thought that contract was part of it.
The
the
professional
profession.
fees, Emma, are what we pay for legal fees. So
Mm,
Skip's
okay.
on the line here. He's underneath that
Mhm.
group. And then we have what we pay for our ED physicians. So that's the biggest chunk that we have for professional fees. So as you know, we have Puget Sound physicians as our ED physicians. And so that's the biggest chunk that comes out of pro fee physicians. And then also it's a little bit more as well, because all the professional fees that you cannot capitalize for the hub construction and the MRI construction, those also go in the pro fees. So some of those will go down once the hub is actually built, because all the legal fees, the bank fees, the construction fees for like the city and for all of their engineers and things like that that do not get capitalized, they wind up in that pro fee expense. So we should see a better number of that once the hub is actually built. But the biggest chunk is our Puget Sound physicians, and because we're seeing more patients, that number will go up. That's kind of how we built that. We want more volume, and so when they have more volume and they see more patients, and they get more compensated, so it's more of a win-win situation with that contract than a really high number flat that we have to work our way up to. So we made that contract beneficial to both parties.
How about the other expenses? And one more question, in the past, we used to you always include in our financial report, also the commissioners, there's also a budget for the commissioners. Where does that fall into category? What category?
Yeah, that's a great question, Emma. So what gets paid for your stipends, of course, comes out of salaries expenses. Any other expenses would come in the other expenses. So like the election expense that we just paid for, that comes out of the other expenses. There's also gains and losses on our assets. There's non-labor expenses that we pay there, B&O taxes, property taxes, that's kind of postage, those kind of things wind up in the other expenses there.
Okay, thank you.
Mm-hmm.
Thank you, Emma.
Patrick, I'm excited to hear about the Rural Health Transformation Program. I've been following that from coast to coast. Do you have any idea yet, specifically for our district, how much we're getting and what we're using it for?
Yeah, so we will be getting somewhere around the $600,000 to $700,000. There was initially only 29 hospitals that were part of that category. They added 3 more actually, so there's 32. That is splitting that $29 million for the 1.3 part of the Rural Transformation. WSHA just got the contract yesterday from the Healthcare Authority, so they are reviewing that. Once we do that, we will be able to use those funds. I mean, the biggest piece of the funds that'll be used for were probably IT related. The executive team will be meeting to really go over that contract, what we can have on the contract. It will be super important to make sure that everything that we have on those funds is appropriate and able to use and trackable, because it's a use it or lose it type of things. And it's not only lose it or use it for us, it's for the entire state. So if any entity is not doing it correctly, we need to make sure that they are moving those funds into areas where it is allowable. The HCA has some guidelines on that, and WISHA's helping us with that. We will get to see our contract from WISHA in the next couple of weeks there, and we'll be able to go over that. But the main things are IT, cybersecurity, AI, things like that. And then there's also any equipment that you, not equipment, but capital improvements that do not increase the value of your building, which is like really hard to do. So, but an example would be is if your HVAC system is busted and going down and you need it in order to do that, you're just going to replace it with a similar valued system. And so that would be okay. The good news is we probably it will be funded for the next 5 years. So this year and then 4 more following years. You can do projects. We found out as well that go over multiple years, but you just got to make sure you don't spend the funds from one year back to the other year or anything like that. So you can stage out some projects. So
Patrick, if I could jump in and just make it really clear. We intend to use these monies for things that we already needed and that we were already budgeting for. And so we aren't creating any new projects with these funds currently.
Correct, but we can't have started them or paid for them yet. Right. So
right. I guess I want to make
it
clear that it's not $700,000 to go do anything we want with. That we
no. Yeah.
And to be clear and to have more details, if the people want to know more details, all of that will be in a ledger identified as is, correct?
We're required to report on it and give those reports.
Exactly. And then we will also be required to have a single audit in addition to the regular financial audit on that every year too. Because we have our USDA grant funds and that audit threshold is $1 million. So we'll be well over that $1 million threshold, at least in 2026. It is specifically spelled out for federal audit in the guidelines for single audit to the RHTP funds. So yes, it will be very closely scrutinized by us, by WISHA, by HCA, and then of course CMS will ultimately be looking at that too. So we will make sure that we are crossing all of our T's and dotting our I's.
Very good. Thank you.
Does that mean I don't get a water slide at the hub?
No, I'm sorry.
Unfortunately, no
somebody
pool
else
either.
wants a pool too. Everybody wants a pool.
Yeah. I think one other thing that I wanted to mention about the financials that we talked a little bit about at the finance committee is you'll see the payroll and the warrants coming up. We have a tremendous amount of payroll right now. We expect it to obviously to continue to grow. And there are approximately 110 heartbeats on the hub project right now on any given day. All of these people have families, and these are great living wages that can support families in our community. And it's not just our staff and our payroll right now that we're supporting our community through, but all of these workers and their families that are coming in. And it's just, I think the commissioners on the board and the staff should be really proud of the economic impact and stimulus that this project has had on our community.
Yeah,
that's a really good point, Renee. Thank you.
Yeah. Okay, Patrick.
So, taking a look at the balance sheet, Renee just mentioned we have our payments, so our cash is going down, but again, it's being spent on this investment for the hub. You can see we still have $114 million in the investments. $22 million that's unrestricted. Those are numbers of cash that we never had previously. So still 100 days of cash on hand that's free and unfettered. So we're in a good cash position. I always want it higher, right? That's what we want to be able to do because it enables us to do things like we're doing, making the hub investment, and what we've done over the past 5 years has really helped build us to that position. The other good thing is, as you can see, our patient accounts receivable, while they're higher, the days are down to 45 days, and the reason the AR is higher is because we're seeing more patients, we're having more charges, and so despite the fact that those charges are increasing, we're actually collecting quicker on those things too. So that's good despite all of the denials and things that I mentioned before and the contractual adjustments. Long-term assets, you can see the SERP investment is on there this time for the retirement that was passed by the board. So you will see that going forward as a new line that you didn't see in previous months. And then there's our construction in progress, the 37 million to date as the end of March that has been spent on both the hub and some other small construction like the MRI project. Any balance sheet questions?
It's a general question, Patrick. How far is the delay typically for insurance providers to reimburse the hospital for expenses?
That is a great question. It depends on the provider. Medicare pays a clean claim in about 18 to 21 days. Medicaid actually pays in about 30 days. Most commercial payers are over 70 that they take to pay the claim. So they're collecting premiums, earning interest, denying claims, and then paying us 60 days later. So that's the market that we have to deal with there. So it's really interesting and a challenge, and we try to work collaboratively. I don't want to put, people need insurance and those things, and we work with them, and the collaborative is working. We're actually working on a Medicare Advantage proposal group that I'm a part of, as well as I'm on a group with the collaborative on a Medicaid MCO improvement. The big challenge with those is all the additional administrative burden and hoops that you have to jump through in order to get your claims paid versus Medicare, straight Medicare is. And they wind up hurting the patient because that care, patients will not get care, or they'll delay care, or they have a big bill holding over their heads because it was denied originally. And over 60% of denials that are appealed are paid. So even though they may come across originally as medically unnecessary or didn't follow anything, it's just a flat out first denial that happens a lot. That's just the hoops that we have to jump through that. So of course, each one of those claims costs us about $300 to rebill every single time too. So you got a $10,000 claim going out that gets delayed that we don't get for 70 days. And then we have to add all the expense of the follow-up and then an additional expense of rebilling all of those same things. And it's amazing how they lose copies of medical records, but they sure don't ever lose sending me a bill every single month. So that's just the way that the healthcare industry works right now.
My guess is with all the excitement and all the potential that we have going on, that this is the one factor that costs you sleep.
Which is the payments?
The delay in payments.
Yeah, that it is. That's one of the factors.
Yeah, I was gonna say I can guarantee it's not the only one.
It's a big one.
Finding right staff, finding, there's lots of reasons why. I'm at a rural CFO conference right now, so it's fun because I get to commiserate with my fellow CFOs, and we're all in the same boat together. We literally are, and we're doing very well. Compared to a lot of peers. So even though it's a negative budget, I mean, there are people with way less days of cash, and they're a tough thing. And that's their communities could lose their care. And that's a big thing. Like they're going to have to travel hours to get just basic healthcare and things like that. So it's really important when we band together and talk about this, and to I'll probably start crying, but we need to make sure that people have access,
Mhm.
to healthcare. So that's why I love doing this.
Yeah,
Mhm,
Patrick, I'm so
mhm.
glad that you're there and you're having that collaboration. Thank you.
And Patrick, I think you're doing really good. We are still staying on top. We're not solvent, that we're paying our bills. That's wonderful.
Well,
But my question also is maybe with this, it's a common practice sometimes where that delay comes, right? So how do we, as a collaborative group, can change that behavior, the delays, the denials, and all of that?
Yeah,
Maybe that is something to look forward to discuss for further discussion. But I'm glad you're there. Thank you.
Yeah, thank you. So yeah, there are things, that's where some of this rural health transformation funds will help, and being able to have AI on our side to work some of those claims and those denials, and working together with that. So but yeah, write your congressman about Medicare Advantage and those things
Yeah.
too. So
To
it's
release all
very
those
important.
funds.
Yeah.
They have to release all those funds right away. Thank you.
So, taking a look at the statement of cash flows, net cash from operations is doing what we expected, right? So we're spending the cash on the employees that we've hired, as well as what we have in the biggest one you can see is salaries and wages and benefits. And the good news is our increase or in patient net revenue. So about a 5 million in preliminary for our operating activities. Investing activities, we're spending on that. That's the building, but you can see investing, we're earning quite a bit on interest, which is good. So cash to date is a couple of $1 million lower than where we were at the beginning of the year, but again, I've talked about that ad nauseum. And we have some of the dashboards to review. So that purple line's our budget. Always you can see days cash. We're below where we were because we had a big influx. But we're right at that budget line where we expect to be. That days in AR number is really great. You can see we budget for 50 days. We're well below that. Talking about the employees, it's great to see that as we increase the employee staff. Net patient revenue is growing, not where we at budget, but you can see it's way above where it was a year ago. So I think that's what I was trying to talk about earlier, that while we're not where we want to be yet, by the end of the year, we should get there.
And just to bring emphasis on the AR, you just heard Patrick share really from the heart about the angst and the frustration that you deal with on a day-to-day basis, in really keeping, when the invoices go out, that we get paid as fast as can be expected. And that being said, if you look at the AR days down in the 45 range, that is spectacular. And you have worked yourself to the bone on efficiencies and your entire finance team. And thanks for the great work.
Yeah, well, when it gets to 30, I'll think that's fantastic. So, but yes,
I like
we're
it.
we're doing well.
Yep.
I think Tammy next has some comments.
On that note, I was just going to call out Patrick being a Gen X and not being able to to take the praise. But I think what I'm most drawn to is the people you see on this call, our entire leadership team. They are working hard. Everyone is working very hard. These are not just data points on a graph or numbers on the axis, but actually represent people working really hard to operationalize and make this happen. So with that in mind, I did want to start with one small item. Renee had mentioned earlier provider recruitment, and I wanted to give a brief update. So I did a little tally mark, some hashtags here. So in addition to a couple of the providers, of course, You know about Dr. Pasupaletti. I have spoke to or interviewed or screened over 11 providers in the last month and a half that want to come work with us. That's not including the one that we signed, our ENT, as well, and doesn't include the CMO candidates who Renee has been screening madly. So we have a lot of interest. I think I said that last month, but very cool. And providers that are not even trying to recruit, they are reaching out. So also shout out to our recruiting team and HR, because they have been working really hard to screen all of these. They funnel them through to the executive team and leadership as a whole. And man, do they have a lot of work ahead of them in the next 10 months. So we have a ton of hires to make happen. So, all right, let me get down to the numbers here. So as you heard Patrick and Renee both state, you'll recall that we had an aggressive budget line here, but we have the entire year to get there. So we are not worried at this point in time, and we have some good numbers moving here, as you see in RHC, and particularly North Bend. We are not yet meeting goal, but we're getting closer every month and feel good about, with the winter easing into spring, what we should start to see throughout the summer months. We're working on small strategies like sports physicals to happen with the school district, which has in the past been University of Washington, who's had a presence there, and we fought for a foothold for it to be our providers. So we learned today that with Kelly Bender's great work and partnering with Will Pand and the clinics, that we will be having that presence. So that's a simple thing, but I'm super excited about that. All right, awesome. I'll pause there. I see some clapping. Thank you all for that. Thank you to the teams. All right, I am going to drop down to therapy though. So we've talked a little bit about agency, and that's always on our minds, is thinking about the cost of agency, how much it is. And we do, sometimes it is a couple of steps, one forward and two back when it comes to agency, right? But with therapies, Lisa Childress, Director of PT and Rehab, and Lisa, forgive me, I don't have your new title top of mind, but no further travelers. She, in her report to me this month, was sure to put, I think, 3 exclamation points on that. No more travelers in therapy, which is very cool. She also shared that she had the highest number of referrals to therapies in the last 8 months. So that also means that Kelly Bender's work is working along with primary care, along with Will Pand, and everyone in the clinics, to make sure that we're remembering to use our own services. And not to mention our fabulous therapist. We just have a really great crew up there, and they are working hard in PT, OT, and speech. So good stuff there. You see a small decline in inpatient, but we had some inpatient numbers decline last month as well. All right. Renee already gave away I had to scratch out the line item. I was going to tell you what happened in lab. And so when my colleagues give those away, which they get to do, I'm like, darn it, I don't get to tell you that. However,
sorry, Tammy, you can tell us again. It's awesome.
It is going to happen again. I full on believe it. And it's so exciting to have the teams report out every month that they have groundbreaking numbers. So Kelly also said, in addition to what you heard, that doubling of the volume, 28% increase in panels. Well, what's a panel? A panel is a test, of course, or a number of tests on one draw. So 28% increase, it's just significant, and it's a big deal. And remember, there is a human behind every one of those tests that are processed. There is somebody who's running that test, whether they are collecting the blood, they're putting it through the analyzer, and that's where my expertise ends. So I'm going to have Renee speak to the rest of that, because I'm just a provider here. So I don't have anything to do with that part. So but overall, really proud of that team. Any questions here on this page? We will move to the next.
Tammy, it shows you how proud you are.
So much fun. This team is the best.
Absolutely.
Truly the coolest team to work with. All right, endoscopy. Here's another area where we see that we are at actual for last year, but under budget. Confident we're going to get there. And Dr. Shaw and Director Pand and a whole lot of others are working to get those numbers up. including Dr. Rappaport, who is serving our endoscopy patients Mondays and Tuesdays, and Dr. Chen, who's doing a fabulous job the rest of the week. So confident we're going to get those numbers up for endoscopy and screening colonoscopy. Mammography, again, not where we want to be. I dug into this a little bit with Steve Bradshaw. He said, you know, staffing is stable. I'm not really sure why. We're seeing a bit of a decline. And when this happens, again, we don't get nervous. We dive in and figure out, what could it be? Is it marketing? Is it the time of year? Do we need to do a better job of marketing to our own employees? All of those are yeses, all across the board. So we don't wait for October for breast cancer awareness to drive these volumes up. So we are working with marketing to make sure that we can get creative with making sure that we have screening mammography and our numbers are where they need to be. All right, I'm going to hop over to MRI because that number is super cool. And I think that Steve was telling me 69, a record for MRI. And I get to attribute a lot of that to our specialists. While they are slower to ramp on the clinic side for volume, they are ordering the tests that you would anticipate for a specialist. And one of those areas is MRI. So super excited about that. Ultrasound also over budget and over last year's actuals, while CT and X-ray both a bit down, but that tends to follow volume, in this case in the ED. All right, Jen, we can go to the next slide. Unless there are any questions, I should pause there. Okay, hearing none, I'll go ahead and go on. All right, and here's where we've got some interesting data. So I was able to connect with Trisha Ralston, Dr. Shaw, and Annette, who does our intake process, and Nicole Reed, who is working with on managerial support for the unit. And we were talking about observation hours. Dr. Shaw said, no, yeah.
Quick breath. Emma, do you have a question? I saw you.
Yeah, I just wanted,
yeah,
I'm sorry, I was muted. I was on mute. So
oh, no worries.
I wanted to ask a question about our new mammography that we purchased.
Mm-hmm.
What is, we call it, there's a name. It's very a sophisticated device.
It's 3D mammo.
3D mammo. And I didn't get why is it down. I guess the rationale why, besides the marketing, I think we have to market it more.
No, I think it's because we've had some real inconsistencies in our staffing. Our full-time mammo tech had to go take care of family members. And so we've been doing it with some per diem, some wonderful per diems, I might say. And I think we just we've had some lack of consistency. And we'll look to Bradshaw to give us a little bit more insight into that next month. But I think that we've just, that staffing kind of got off to a tough start. And then we probably have some more opportunity to market to the west of us. So that people that have long wait times in other systems can come use ours. So we'll give you a better report on that next month.
Wonderful. Thank you. Appreciate it.
Great question.
Yeah, I bet Manager Bradshaw would love to come speak to you, Commissioner Herron. And I'm sorry I didn't see you trying to ask a question. All right, I will pause there, though, just so I know that we are running close. Any questions on this? I was going to speak to observation, but the message here is observation hours declining isn't always a bad thing. It's where you're looking at conversion to an inpatient visit, and then, of course, watching our swing volume. Any questions for me on the volume graphs? And thank you to Shauna and team for preparing them.
Tammy, thank you.
Thank you.
Okay, now we are on to approval of warrants. And just a quick highlight here, we had 2 pay periods this month. You can see, thank you, Jennifer. You can see the results of the month, and with that, I'm going to ask for approval of the warrants in the dollar amount for the month of April, $10 million, $163,100. Can I have an approval of the warrants as indicated?
I make a motion to approve the payroll.
The warrants.
The warrants. I'm sorry. The warrants.
Thank you, Commissioner Herron. Can I have a second?
Second.
Thank you, Mr. Bowers. With that, made and seconded, approval of the warrants for the month of April 2026 of 10,163,100. All those in favor, please indicate by saying aye.
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 Aye. Opposed and abstaining, hearing none, motion carries. Thank you very much for that. And with that, I'll go on to, we are on to commissioner comment. And I am excited to hear about this. And so with that, I'm going to call on Commissioner Herron. Do you have any comments to share with us?
Yes, we're moving to a very exciting period and some new developments, and I'm really grateful and thankful to all the hard work that our team, our executive team, and everybody part of our organization is doing. And I'm happy that no matter how difficult it is when it comes to finance, I know that we are really trying to meet our goal. And we are still, like I said, we're still staying on top of things in spite of the 110 heartbeats that we have to, is that what it is, the number? And, you know, I think it's a big worry if we cannot even pay our employees because they have to have something to put on the table for their children. So I'm really happy for that because I know that it is very difficult sometimes to think that where are we getting all this money from, you know, with all these big projects that we are doing. But with frugality, part of it is, you know, doing our due diligence and not just thinking that we have all this money that we can, you know, toss around, or that we are fiduciary responsible for not just the hub, but the people that we serve as well, that we are mindful of our operations. I thank you all. Thank you.
Thank you, Commissioner
Moving
Herron.
forward.
Commissioner Carter?
Thank you, President Hagley. Thank you to Commissioner Bowers for your time serving as the board president. Appreciate your leadership. Thank you for everything. Very excited. I echo what Commissioner Herron said. We're entering a new era as a board, feeling very optimistic and hopeful that we're going to move forward and be productive and be collaborative. I'd like to thank everyone that expressed interest in the board vacancy, and I look forward to getting to know our three candidates a little bit better next month. Tricia, you're right. You have got the highlight of every month when those stories. Don't limit them at 1 or at 3. We just keep them coming, and that is just fuel for our hearts. Thank you. It's so reflective of the culture that you have all built and that you all live every single day at the hospital. So thank you so much, everyone. The hospital and the clinics, broadly in the hospital. So yeah, big love to everybody. So looking forward to what the spring and the summertime is going to bring us.
Thank you, Commissioner Carter. Mr. Bowers, Commissioner Bowers.
Yes, sir. I have to say, first of all, I'm very excited about the very positive and optimistic tone that the board has now. And I think staff and the community would see that as a positive change and a welcome one. What really moved my heart tonight was to see Mr. Ritter go into tears. That demonstrates to me what our staff means to us and what their desire is for the community. I just think that's incredibly commendable. CEO Jensen, I've seen you at work in Olympia and in Carnation and here in North Bend. You're just amazing. I think you could probably run for governor. You get my vote.
Thank you, Commissioner Bowers. I am absolutely honored to fill the seat again, to watch everybody with, and I'll use in observation of Mr. Ritter, a passion about the the why we do everything that we do, and you all do. It is absolutely a joy. At some level, I almost become speechless. Great words have been said by the entire board this evening, and I thank you all for, again, the tone and the civility. It is just absolutely fantastic. Congratulations to the executive team and everybody that works so hard for everything that we accomplish. And I always like to say this is just the beginning. Tomorrow's a new day. So with that said, we are going to now go into an executive session. And I need to convey some information here. Board of Commissioners is authorized to meet in executive session under RCW 42.30.110(1) and to discuss with legal counsel representing the agency matters relating to agency enforcement actions, or to discuss with legal counsel representing the agency litigation or potential litigation to which the agency, the governing body, or a member acting in an official capacity is or is likely to become, excuse me, a party when public knowledge regarding the discussion is likely to result in an adverse legal or financial consequence to the agency. With that being said, we should expect to reserve approximately 15 minutes. Is that sufficient, do we think?
I think
Renee?
10 minutes would be plenty.
10 minutes. Thank you very much. Skip, would you be so kind as to watch that clock? And then Jennifer, if you would be so kind as to move, are we going to move into a separate room?
Yes, we will. And just for those that are on the board meeting, thank you very much for your attendance tonight. We don't anticipate any action following the executive session. So if you wanted to tuck your kids in or get dinner, this would be a good time to do so.
Following the executive